Hey guys, this lecture is on emerging infectious diseases, and we're going to talk about some diseases that have been around for a long period of time, but they're not something that we see commonly within the United States. So I've tried to tailor this primarily for diseases that are common in the United States. However, we will be covering some that are primarily located elsewhere, but have the potential to be able to be transmitted within the United States as well. So over here on the left of your screen, so this head covering is actually what they would use during the bubonic plague. This one is made out of leather, and they thought that if they inhaled air that had been filtered through this special filter, that they actually would not get the plague. And actually, plague is still around today, as we'll be talking about during this lecture. Okay, so first we've got some definitions that we have to know. So endemic disease. Endemic disease is the normal level of disease that happens in an area. So endemic is just the baseline, what happens in your area throughout the year. Now, an epidemic is a drastic increase in the number of positive cases that is geographically located in a very small area. So we would talk about an epidemic happening in a certain city, okay? And then as it starts to become worldwide, that's when we talk about it as a pandemic. So endemic is the basic level of disease that happens within an area, geographically limited all the time. Epidemic is a surge in that disease that happens in a geographic area for a limited time. Pandemic is going to be something that is happening worldwide, and with large scale infections of new cases of disease. So two other words you need to know is incidence. Incidence is the number of new cases of disease that occur within a time period. Usually we look at incidence rates for annual incidence rates, so yearly levels. Prevalence is the total number of people who have ever been infected with this condition. So we'll be using these words throughout the presentation. And also there's two more words, FOMITE, F-O-M-I-T-E. FOMITE is something non-living that can transmit disease. So water fountains, door handles, okay, cell phones, those can be fomites. They can have infectious agents on them that by touching I can get infected with the agent. And then the other one is called vector, VECTOR. A vector is a living organism that can transmit disease to me. So infectious disease mortality, it was really high in the beginning of the 1900s. And then around the time of between World War I and World War II, Andrew Fleming discovered penicillin, and so that was thought to be the wonder agent, and infectious disease would be no more. But if you look at this graph, what's happening is over recent years from 1980 on, we have had a sudden insurgence of cases, and so of different infectious diseases. And with that, that's saying that the bacteria are getting smarter, that the viruses are getting smarter. They're able to evade the common ways that we have used to be able to prevent disease in the past. So globally, the infectious disease is a huge threat. It kills many, many different people annually. So in the 20th century, we've seen the reemergence of infectious diseases. So these diseases can be newly identified diseases such as COVID-19. They could be known diseases such as malaria that we still have to battle every day in certain countries. It could be things that are related to certain geographic areas. But what we have seen and have identified everywhere is there's increased epidemic activity. So diseases are reaching epidemic levels in different individual geographic locations more frequently and more severely than they have in the past. So in 2003, about a third, 26% of global mortality was due to infectious diseases. So this is an example of many of the different emerging and re-emerging diseases. So things like measles, we thought we had under control with vaccines, but as a result of um, a decreased push in vaccinations, we had a surge in cases of measles related to exposure at Disneyland several years ago. So these emerging diseases can be antibiotic resistance. It can be related to different mutations of viruses. It can be related to changes in the vectors like mosquito presence. And just know that worldwide we see lots of different emerging and re-emerging diseases. So some examples of global public health emergencies. Okay, so plague. Is still around. It caused an epidemic of cases in 1994 in India. Hong Kong has had some influenza epidemics. We've had Nipah encephalitis in Malaysia, SARS, avian flu. More recently, we've had MERS, Middle Eastern Respiratory Syndrome, and COVID-19. And also we had an Ebola scare here in the United States about 5 years ago. So why are these infectious disease rates increasing? Part of the factors are human related factors. So policy changes, the express funding for disease prevention has been decreased over time. But a larger factor is actually modern transportation, not transplantation, modern transportation. And so we're able to fly anywhere in the world and be there in a day. And then we can be there delivering our disease organisms to those people, obtaining some of their diseases. And then as a result, bringing it back home and creating more infectious process. So demographic changes can be a result of population growth. So there's a population surge currently going on. People are moving away from the counties and the rural areas and moving closer together. So urbanization is also a factor. It's putting people closer together, so you're more likely to share germs. Agricultural practices. So many of these diseases actually started as a zoonotic disease and then transferred to humans. And so the closer that people are to animals, that can also contribute to infectious disease process. So environmental factors, microbials change over time. This can be bacteria, it can be protozoa, it can be fungi, it can be viruses. They all mutate and adapt to their environment. So their key goal is to survive no matter what is thrown their way to try and kill them. So microbial organisms will adapt and change to help themselves be able to hide from the being killed from different medications. Climate change. That is a factor as well within infectious disease, and we still don't know the long-term effects of that climate change. So another thing is our people as these cities sprawl and get larger, people are starting to encroach on natural habitats of land. And so this woman was just walking through the streets and a monkey comes and jumps on her. So it's creating enmeshment with animals and with people, having to share environments that haven't previously been shared. So it's putting us in closer contact, and increased risk for zoonotic disease. Zoonotic disease is going to be disease that's transferred from animals to people. So infectious disease transmission, again, we talked about transportation. We're able to move around within the world and be able to bring those microbes with us, exposing other people to our microbes while bringing other people's microbes to new environments. This picture is of airplanes, and this is over a month, the number of airplane routes. So you can see from this picture that we are a very mobile society and we are a very mobile world. So it's truly a one world infectious disease process, not just individual countries. Drug resistance. So this picture over here to your right is a worm that has created resistance to different types of medications that are attempting to kill it. So drug resistance is a big problem with an infectious disease process. So the first infectious disease that we're going to look at is dengue fever. Dengue fever is something that causes hemorrhages. So it's a hemorrhagic disease. It's going to cause massive bleeding, and it's transmitted by a mosquito. And so with it being transmitted by a mosquito, you can be bitten and the substance gets into your body. You also can be exposed to dengue fever through healthcare, through being a healthcare provider. That can also be a way that you're exposed. Pregnancy, you can also transmit dengue fever to your unborn child as a result of being bit by a mosquito. So dengue fever, it affects about half the world. There is a vaccine that's available to children 9 to 16 years of age. You can get dengue fever more than once within your lifetime. So this vaccine can be given to strengthen immunity if previously infected with the disease. So this is something that requires supportive treatment. You're going to be giving a lot of fluid and a lot of blood. So two new concepts to look at is IgM antibodies are going to be produced for the current illness. Okay, so these are our active antibodies. IgG antibodies will be able to be tested to see if you've had this disease in the past. Okay, so if you have active IgM antibodies and are negative for IgG antibodies, this is your first exposure to dengue fever. Symptoms of dengue fever. So it's a hemorrhagic disease. It's going to cause bleeding from mucous membranes, have a sudden onset fever, dengue fever, increased intracranial pressure, causing a severe headache, muscle and joint aches and pains, vomiting. The irritation from the vomiting is going to increase the risk of GI bleeds, diarrhea. You're going to have a rash. With this, you also will start to get gastrointestinal bleeding, which further affects your blood pressure and your ability to be able to function with this. So dengue fever is present in the United States. There's very few cases within the United States, relatively speaking. So, but it does show that this isn't just a third world phenomenon. This is also a first world phenomenon. Okay, yellow fever. So this is a political cartoon from many years ago, talking about yellow fever being brought into New York City. Yellow fever is spread by mosquito bites. Most people won't even know that they have been exposed to yellow fever. However, some people are going to react very badly to being exposed to yellow fever. This is a vaccine preventable disease. You will need the shot, the vaccine for yellow fever, if traveling to endemic areas. Remember, endemic means where it's common throughout the year at a certain level. So yellow fever is common within South America and Africa all the time. So you tend to develop symptoms 3 to 6 days after the bite. So you will develop a fever, chills, headache, backache. Your liver will eventually start to fail, causing jaundice. And of the people who are infected and develop symptoms, about 15% develop a significant serious illness that causes bleeding, shock, organ failure, and eventually death. So it's a very quick acting illness that can cause death. And it's caused by a mosquito, and this is the Aedes aegypti. And this critter causes many different kinds of diseases, um, as we know. Okay, so this would be a vector transmitted disease because something living is doing the transmitting. It's not that you're getting it from a non-living surface. West Nile virus. West Nile virus caused a big fear within the United States. And West Nile this virus had been endemic to Africa for a long period of time and then was suddenly found in mosquitoes that had come over to the US, hauled up in boats. And so with that, West Nile virus became endemic within the US as well. And so that's not really something we worry about much now. But in the past, West Nile virus, which is also transmitted by mosquitoes, was a major issue. Bird flu. Bird flu was a pandemic flu. And so actually all flu comes from birds. So it's incubated in birds. And that's the reason it works for us to grow flu vaccine on bird eggs, because it was originally found within birds. So eventually the bird flu infected pigs. And as we've talked about before, pigs are close enough to people with the anatomy and the MHC complexes that diseases are able to jump from pigs to people that could not make the jump prior. So it couldn't go from birds to people, but it can go from birds to pigs and then infect people. So 1918 Spanish flu. This is a particular type of the flu, and this is called H1N1. So each type of flu is typed according to H1, H2, H3, N1, N2, N3. And this is hemagglutinin. This is the type of hemagglutinin, which is the H. So it's type 1 hemagglutinin, and it's type 1 neuraminidase. Now, hemagglutinin allows bonding to cells to happen, and neuraminidase encodes surface proteins to cells. So for a long time, we really didn't know exactly what the agent was that caused the 1918 Spanish flu. It killed 50 million people worldwide, and then finally in Alaska, a little place called Brevig, that's literally in the middle of nowhere, they had dug down and through the permafrost, and they found some Spanish flu victims. This town was basically decimated from the flu. And so they found some people, some graves that were decimated, or their bodies were decimated, and they were frozen because they were buried so low down in the permafrost. So some lung tissue was taken, and from this lung tissue, they were able to actually genetically identify the agent that caused the 1918 Spanish flu. So the corpse that they removed this lung tissue from was nicknamed Lucy. And so Spanish flu spread, as you can tell this picture over on your right, from World War I troops that were coming home. They were transferring the disease from Europe back to the United States. So people started wearing masks. This should look very familiar to COVID because Spanish flu was the last time we had a pandemic within the United States. And you can see, be a nurse, earn $15 to $25 a week, learn at home. Could you imagine actually being able to go to nursing school for 32 lessons and be able to succeed as a nurse? So granted, medical knowledge wasn't as vast as it is today, but expectations weren't as high as they are today as well. So Spanish flu spread and became pandemic because it started causing high levels of disease across the world. So Spanish flu, they actually enacted wear a mask or go to jail policies within the time of the Spanish flu. It did cause a lot of fear. If you look at the different pictures, it's kind of interesting. They thought that spitting is what spreads flu. So if you didn't spit, then you couldn't spread flu. Look at the way that they had the hospital partitioned off. All that airflow still circulates. So taking bodies out, they had mass graves from the Spanish flu because people were dying faster than they could actually be able to bury them and keep up. And this picture in the center is a vial of preserved Spanish influenza vaccine. Now, the effectiveness of this vaccine is really not known, but with that, they were attempting to create vaccine products to help prevent people from getting and dying from the Spanish flu. So here is Brevig, Alaska. This is where Lucy was buried, and Dr. Peter Holton actually dug into the permafrost, was able to get some of Lucy's lungs and be able to take it back to isolate the Spanish flu. So at the time of the Spanish flu in Brevig, Alaska, 72 out of 80 residents died from Spanish flu. So it had a significant mortality rate. Bubonic plague. So this picture on the left is the way people would dress as they were treating bubonic plague patients. This outfit was thought to, at that time, disease was thought to be caused by bad air or contaminated air. And so they thought that this would prevent transmission of bubonic plague. Now, nursery rhymes, a lot of the nursery rhymes that we grew up with actually are about the bubonic plague. So ring around the rosies, pocket full of posies. So ring around the rosies, they're going in circles around the casket with roses. Pocket full of posies. They had posies in their pocket because they thought that those flowers could help freshen the air and prevent them from getting plague. Ashes, ashes, we all fall down. And so they were doing mass burials and they would burn the bodies, creating ashes, ashes, and then everybody was dying from plague. We all fall down. So facts about plague. Plague is caused by fleas. So what happened during the time of the bubonic plague was they thought cats were a pest. And they got rid of all the cats. They took them away, took them to another area. And so the rats were able to reproduce then and get into people's homes. Well, the rats had fleas on them that had bacteria within the flea that causes bubonic plague. So what happens is it bites a person. It causes an inflammation within the lymph nodes called a bubonic, okay? And then eventually it causes pneumonia. And many, many, many people died as a result of the pneumonia from bubonic plague. So plague is common here within the United States. So it's within the West. The plague bacteria is on fleas that live on prairie dogs out west. And so those fleas can jump off the prairie dogs, jump onto people or household pets, and bring it into individual homes. Bubonic plague, flea bite. So this is a vector-borne illness. A flea bite exposes you to the bacteria. You have 3 stages. You have the bubonic phase. Incubation period is between 2 days to a week after you get bit. You're going to feel like crap, have severe abdominal pain, shock, fever, headaches, internal bleeding, swollen lymph nodes. Again, those are called buboes. Then you start going into sepsis. So with the septicemic phase, this bacteria gets in the blood. Skin on specific areas will literally turn black and die, okay? And it's because we are shifting the blood away from these features like fingers and toes. And it also can get your nose too. But the skin turns black and literally the fingers and toes and nose would start to die and start to rot off, further contributing to the septicemia. Patient goes into septic shock, then also goes into pneumonia, and that is when it becomes severe shortness of breath and the patient dies. So this first picture shows the femoral lymph nodes and how they're swollen up from the bubonic phase. The black spots on the foot are from the septicemic plague phase, and then the pneumonia phase. Look at that lung. It has a lot of consolidation in it. That person's not going to be able to breathe, and they're going to be extremely short of breath and oxygen deprived. Ebola. Ebola is endemic within sub-Saharan Africa. So there have been several different Ebola outbreaks, and Ebola is a very nasty disease. It's a hemorrhagic virus, and what that means is it causes you to bleed. So the person who is dying from Ebola will bleed from all of their openings. Okay, they will bleed from their eyes, they will bleed from their ears, they will bleed from their nose, they will bleed from their mouth, from their anus, and from their urethra. So they have recently been able to show some success with creating a virus to be able to help people prevent getting Ebola. And Ebola is transmitted due to contact with an infected animal or a sick or dead person with Ebola. And so people, with infections of Ebola, they have to change up the culturally approved ways of dealing with dead people. So it creates issues both culturally and within public health, because frankly, this can become a pandemic over a large area. Now, also, recently they have found that you can also get an active case of Ebola, because the Ebola virus will stay in the male in the ejaculate. And so if you have sex with an infected male who has gotten better from Ebola, then you can become infected from that. Now, Ebola is kind of unique because it can be vector based through infected animals, contact with infected persons, sex with an infected male, but it also can be fomite transmission based as well. So the Ebola virus lives for many, many hours on anything that has come in contact with blood. So it could be papers, it could be a doorknob, it could be a toilet flush, it could be anything. So there is an Ebola virus for the version Ebola Zaire. There are different strains of Ebola, so there's only a vaccine approved for one strain. So the way that you get Ebola is by being within 3 feet of anybody who is sick with Ebola. Ebola starts between 2 and 21 days after contact. So this is a unique illness because first it starts off with different types of dry symptoms. So dry symptoms is going to be you feel exhausted. You're going to be having aches and pains all over your body. You just generally feel like crap. And you're going to be running a fever. So then While the dry symptoms are happening, what's happening within your blood is that your platelets are being attacked. So you have no platelets, and as you have no platelets, there's nothing to control the clotting of the blood. So then the wet symptoms start. This is going to be diarrhea and vomiting, uncontrolled bleeding. So the way that you find out if you have Ebola in the United States, they will run a PCR test. So you look at DNA for the actual Ebola virus. They can also serotype it and see specifically what strain you have. But in sub-Saharan Africa, they don't have easy access to that kind of technology. So the diagnosis is usually made based off of symptoms. So the treatment is symptomatic. And so you support whatever symptoms they're having, you work to address those symptoms. And then recently, when we had an American doctor who went to Zaire to be able to help with the Ebola outbreak, and he became infected. One of the patients he helped actually lived, and Ebola has a very, very high mortality rate. But this guy lived, and they went back to him and asked him for some of his blood. So he had plasmapheresis done, and they pulled off the antibodies in the serum from this recovered Ebola patient. And they administered the serum to the physician. And as they administered the serum to the physician, he began to get better quickly. Okay, so these are some pictures of Ebola from some of the recent outbreaks in Africa. And so you can see the way people, this is considered a bio level 4 type of infection. And so you have to have the most stringent biological containment that you can have for Ebola to avoid bringing it back to the United States or to avoid you being infected yourself. So this picture in the upper left-hand corner is them carrying out somebody who is afflicted with Ebola. And this next picture lower down, the same thing. The woman at the bottom is having to burn everything. Once somebody is infected with Ebola, all of the garments, everything that is within that area has to be burned. So furniture that the person had touched, bedding, their clothing that they used, anything that could possibly be infected with the Ebola virus has to be burned. And it's a very, very dangerous situation. She's doing this burning without having any kind of biological protection on. And you can see this gentleman behind her just watching what's going on. So these are some of the mass graves that they did for Ebola, and literally people die faster than they're able to dig graves for. So with these people that are buried in these mass graves, um, they create markers and place over the mass graves that for people who are buried there. Okay, coccidiomycosis. Coccidiomycosis is caused by a fungus. It's present and endemic in Arizona, California, Nevada, New Mexico, and Utah, Mexico, and Central and South America. It primarily attacks people who are immunocompromised for some reason, and it's spread by any kind of dust, whether that be from dust storms that happen in those areas commonly, or if the fungus is in the ground and it's disturbed by construction equipment. There is no way to get the fungus out of the ground. Once the fungus is in the ground there, it is contaminated with that fungus. There's no way you can get rid of it. So there's no vaccine for this, and some varieties of coccidiomycosis are going to be resistant to current antifungal medications. So coccidiomycosis, this is also known as valley fever. You see a rash that comes up on the individual that's been infected, and then these x-rays. X-ray A is him at the beginning part of this illness, and x-ray B, you can see a lot more consolidation within the x-ray as the fungus is taking hold and reproducing within the individual's lungs. Measles. Measles. We thought we had measles taken care of and completely out of the picture. But in 2018, there was some people from another country that came into the United States, went to Disneyland, and during their trip to Disneyland in California, it's many other people from around the world became infected with measles. So it's important to stay vigilant against these diseases because they can reemerge. So with this Disneyland measles outbreak, there was at least 85 cases, and this is just the people that was identified from the United States that became infected with an active case of measles. This doesn't count people from other countries. With measles, you run a very high fever. The measles virus, you're going to get it through inhalation. It's going to take residents within the upper respiratory tract, start reproducing, causing a rash and severe inflammation of the upper respiratory tract. Measles is highly contagious. Incubation period of 10 to 12 days after exposure. Symptoms last for minimum of a week and closer to 10 days. The people that get it tend to have a very, very high fever with it, inflamed eyes, and prior to the vaccine be administered routinely, thousands of people died annually as a result of measles. This is another picture of the measles rash. So this rash is really what's going to be the key in diagnosing measles. Schistosomiasis. So schistosomiasis is a very interesting condition. So the water is contaminated with urine and feces from an infected person. Now, keep in mind, a lot of places where schistosomiasis is endemic, people will be very close to the water. So the eggs that have been found in pee or in a person's poop are going to get eaten by a freshwater snail. So this snail incubates these eggs until it's time to release them, and then it releases the schistosomes. It's an actual type of worm, and it is going to penetrate the skin. What it does is it has hooks, and it bores into the feet as somebody's walking within the water, and it literally will kind of act like a roto-rooter or a drill and drill through the feet, get into the vasculature, and then it sets up lots of infections within the person. So prevalence of schistosomiasis. Schistosomiasis is very, very common in Africa, and it has some many cases within South America as well. So these are parasitic worms. They prefer to live in fresh water. Salt water will dehydrate the worms. So within the world, it is second only to malaria by infectious disease case count. So this is a huge, huge problem. So what this, you'll notice male menstruation. What happens is the worm bores into the skin. It travels around wreaking havoc and reproducing all throughout the body. So it's going to damage the liver, the intestines, the lungs, and set up inflammation and problems within each of these areas. Now, once it gets in the bladder, it will start to bore into the bladder, and that's going to cause bleeding. So within the countries where this is endemic, the men within the community will actually be concerned about their sons if they have not, they think that since girls have their periods, boys have their periods. Well, it's not actually a period. The bleeding is coming from this parasitic worm that has bored into the bladder, and then it comes out and it likes to hang out within the urethra as well. And this causes bleeding. So it's called malmenstruation in some countries. So the countries where schistosomiasis is endemic is Africa, South America, Middle East, Caribbean, China, and Philippines. So to be able to get fresh water that is safe for bathing in, the water needs to be boiled at a rolling boil for at least 1 minute. And after it has been boiled, it can be stored in a tank for several days. So the people in these countries really don't bathe on a daily basis because it's a big production to get enough water that is free of the schistosomes that invade people. Malaria. Malaria is caused by a vector, again, an infected mosquito. So, interesting thing about mosquitoes, you never notice when a mosquito first bites you because they actually inject something very similar to lidocaine in your skin when they first bite. Now, with that injection into your skin, you also can get um, you can get contaminants of the blood that is left in that mosquito from the last person that bit. So this was a concern with West Nile virus, but this also is how malaria is transmitted as well. So the infected mosquito bites you, and then an incubation for a couple of weeks, then you start ending up with symptoms. Symptoms are going to be high fever, chills, and anemia. So what malaria does, the malaria parasite likes to go and infect red blood cells preferentially. When it infects these red blood cells, it actually causes them to lyse. And so that's what's going to be causing your anemia related to malaria. It's malaria is very common in tropical and subtropical countries. And the warmer areas of the United States, it's not as common because our public health departments do mosquito control activities. And they also do that here in Knoxville. So they will literally drive around in neighborhoods and in communities, and they will squirt out at night different mosquito killers to be able to keep the mosquito count down to help prevent some of these diseases from becoming endemic here. So if a person has sickle cell anemia, those red blood cells cannot be attacked by this parasite because they're the wrong shape. They can't actually hook onto it to be able to infect those red blood cells. So sickle cell anemia provides protection against malaria. And so that's one of the reasons that sickle cell anemia was thought to um, become common within the population, is because the people who died from malaria weren't able to reproduce, whereas people who were resistant to malaria due to sickle cell anemia were able to reproduce. So a sickle cell attack can last hours to days. I'm sorry, not a sickle cell attack, a malaria attack. And you may have relapses. So you may start getting better and think that you're kicking the malaria, only to have it knock you back down again. So diagnosis of malaria is going to be based upon where you've been. We also can do DNA testing, PCR, to examine it. Also looking for presence of antibodies within the blood to malaria. And the way that we are able to fight it medically is hydroxychloroquine. And so if you are going to be traveling to a malaria endemic area, it is recommended that you take hydroxychloroquine. And that actually is just going to make the red blood cells a little more slippery, so the parasite can't attach on and create the havoc within your body with malaria. Okay, so SARS. Coronavirus, prior to COVID-19, has been around for a very, very long time. Coronaviruses are what cause and have caused many of our colds for decades. Coronavirus is known to be a fast mutating virus. It's also known to have over 150 different variations. So that's the reason you can get one cold, get over it, and then get a cold later on because you're getting a different variation of the coronavirus. So SARS is going to is one of our first epidemic level infection of a coronavirus. Okay, so it happened within Asia, and it was called severe acute respiratory syndrome. And so with SARS, it was transmitted um, to people who were in close contact with each other, very similar to the type of symptoms that we expect from COVID-19. Makes sense because it too is a coronavirus. So there was an outbreak in 2003, and there were cases all around 24 countries. So what's really odd about SARS is that it just literally poof went away. We didn't know how to fight it. We didn't have a vaccine for it. We really don't know why it went away or what caused it to go away. It wasn't our actions per se. So we really don't know what happened, but that outbreak was self-limited, caused fatigue, fever, respiratory problems, body aches. Then you end up with pneumonia. And when people get pneumonia, that's when they die. So people who would get infected the infection was due to close contact, less than 3 feet. There was no cure for it, and the idea was symptomatic treatment for SARS, but it was our first introduction to epidemic levels of a coronavirus. So as suddenly as SARS went away, then we had another virus come and take its place. This Middle Eastern respiratory syndrome. This is also a coronavirus. And as suddenly as SARS went away, MERS appeared. So it literally appeared in 2012 in Saudi Arabia. It too is coronavirus, causing upper respiratory infections, diarrhea, myalgias, pneumonia, and death within a week of infection. So MERS is what this is called, MERS. And it caused death in 35% of all people who became affected with it and infected with it. And so with this, you would treat the symptoms, and then hopefully their immune system could fight it. If it couldn't fight it, then they died. So this brings us to COVID-19. With COVID-19, I'm sure everybody knows a ton about COVID-19, so we're really not going to go over that a lot. But lisinopril is thought to be protective. So people who take lisinopril are actually less likely to become infected with the virus because it makes it harder for the virus to attach to cells to infect it. Incubation period is 2 to 14 days. Fever, cough, shortness of breath, fatigue, diarrhea, runny nose, loss of taste or smell. So immunoglobulin treatment is effective for COVID-19. Again, we get those immunoglobulins through people who have had the virus, successfully recovered because their body was able to make the immune system factors to be able to treat it. And we also will put people prone, because what happens if they're laying on their back is they start to drown in their own fluids that they're making. So by putting them prone, we are able to help them get the fluids out of their lungs that's stopping them from being able to breathe. Now, just like SARS and then MERS, COVID-19, we will be having future encounters with coronaviruses in the future. So they typically have been self-limiting, and you really hadn't heard of them prior to COVID-19 because they were an annoyance more than anything. You would feel really crappy for 2 to 3 days, then you'd start to feel better. It caused a few deaths, but the deaths tended to be people who already had pre-existing conditions. What really scared us with COVID was, and MERS and SARS, is that it's young, healthy people with no other comorbidities that are getting pneumonia and dying. And so it became a much scarier prospect. This will not be our last encounter with COVID. It is still mutating and still changing, and it's still able to infect and reinfect every time it mutates and changes. So it's literally part of our endemic infectious disease process now in the world. And so it's just something that we're going to have to figure out how to deal with and maintain the world as we know it. Okay, thank you very much for listening. This is somebody being prone as a result of COVID. And again, that helps get the fluid out. Okay, so that was a fake out. You aren't done listening yet. Zika virus. Zika virus is something that was mosquito transmitted. We had outbreaks of Zika virus within Florida from 2016 to 2017. It's still very present in India today. It has been eradicated in the United States since 2019. So it's thought to be eradicated due to stepped up mosquito control efforts within endemic areas for Zika infected mosquitoes. So this is known to cause birth defects. It's known to cause Guillain-Barré syndrome. It can have asymptomatic carriers. You can find out if you have it through blood or through urine. And again, this is something that's symptomatic treatment. Okay, hope you guys are having a great day. Thanks. Bye.